So I'm an odd choice to start out. I've never worked here, and so I've had no official role at CDHA other than external affiliate or something, which I think I've been since 2004. It must have been the first renewal grant. So what I'm going to talk about is from hanging around CDHA all these years. I pop by once a year or so, but really most of what I've learned from afar. I'm going to give a short research talk, but it's sort of an effort to draw out some themes of things that I've experienced here and at similar institutions. And then I'm going to give some meta reflections. I think that's the title of this session, and I took it to be so sufficiently vague that I can talk about anything I want, which is what I'm going to do at the end. So the research talk is work I'm doing with Joe Ferry in economics at Northwestern and with a graduate student named Mark Lee. And it's about the long-term impact of lead exposure. It's about the effects of early life lead exposure on cognition and psychological stress decades later. If this were a real research talk, and if I had lots of time, I would talk a little bit about the biological processes here. Basically, lead gets absorbed where calcium should get absorbed in your synapses, and that leads to short-term cognitive problems and other developmental problems. And there's quite a bit of research to demonstrate that. I have colleagues who ask me, why are you studying the impact of lead? We know it's bad. But in fact, we don't know much about the long-term implications of lead exposure. There isn't good science that follows people for decades and has good measures of early life lead exposure. And so that's what we're up to. And very basically, the question is whether very early lead exposure predicts cognitive functioning and psychological stress decades later. So the innovation here, responding to my colleague who wonders why anyone's still studying the effects of lead, the innovations are that we have a very long follow-up period and can look at the impacts on several well-validated measures of cognitive and psychological functioning later on with a large population-based sample that is much more representative than most. So to do this, we use data from the Wisconsin Longitudinal study, which may not surprise you, linked to the 1940 US Census. And before I get into that, I have a question that I can only ask in this audience. This is the WLS logo, and this is a version of the CDHA logo. And only in preparing for this talk did I notice that it's the same damn people, except for that one. Why was that person swapped out? I need an answer.
Copyright, yes.
Which came first, and what was the rationale behind getting rid of it? No one knows.
You're spending too much time on this one.
I know who did it, but
All right.
we're going to remain nameless because she was one of the people Bob mentioned in his talk.
All right, I'll let it go. So the WLS in the 1940 census, and there's another interesting sort of what is new is, or what is old is new again. The 1940 census, of course, a pioneer in producing microdata for the 1940 census was our own Hal Winsborough, right? He was among the team instrumental in generating, I think it was a 1% sample of 1940 and 1950. So it's kind of nice for this occasion that I'm linking a Wisconsin product to something that Hal helped create, although we're using the 100% sample. So the WLS in this context, I don't need to tell you a ton about. I presume, looking around, that everyone in the room is basically familiar with the Wisconsin Longitudinal study, so I won't spend time there. The 1940 census is public. The census data, as you probably know, are public after 72 years, including names and exact street addresses and everything else. 1940 is the most recent. 1950 will become public in 2022. And 1940 included, it was really the first modern census that included detailed information about education, income, occupation. Of course, we have precise geographical location. And the 1940 census, like all of its predecessors back to 1850, has been fully digitized with 100%. There's no more samples. We have 100% count fully digitized and released at IPLMS.org. So we linked them to the WLS as part of a broader project to link aging studies to the 1940 census. And so from the WLS, we know people's names and their birth dates, but also we know the names of their family members who should have been alive in 1940. And that makes it, from a record linkage point of view, like shooting fish in a barrel. If you know a ton about someone's family, you can find them. There may be a lot of Bob Smiths born in Wisconsin in 1939, but there aren't that many Bob Smiths with a dad named Jerry and a sister named Katie, right? So it's relatively easy to find WLS respondents in the 1940 census. So we used a supervised machine learning algorithm that I could go into if this were a real research talk. But basically, we linked them, and we found 86% of them. And being very strict about erring on the side of caution. We don't want to declare links when they aren't there. So we did everything we could to avoid false positive linkages. So 86% is a really good accomplishment. And then the outcomes that we consider from the WLS are, other than high school IQ, are all from 2011. So a variety of measures of cognitive functioning and psychological stress. On the independent variable side, we know where WLS respondents lived in 1940, precisely where they lived, their exact street addresses. We proxy their lead exposure based on the composition of the pipes that were used in the municipal water systems that served them, and the pH of the water. And so this is sort of a stylized graph. You're fine if you have lead pipes and the water is balanced, but if the water is either acidic or alkaline, then chemically the lead leaches into the water. So if you know exactly where someone lived, and you know what the pipes were made of and what the pH of the water was, you can infer something about the lead that would have been leaching into their water. And we do know that for people that lived in any kind of an urban area in Wisconsin in 1940 from the U.S. Geological Survey. There's information about the service line composition, so were the pipes lead or not, and what was the pH of the water. So this restricts us, of course, to people who lived in urban areas in Wisconsin, not just the big cities, but even smaller towns, any place that had a municipal water system. And we adjust for some stuff. People didn't live randomly anywhere, so we adjust for some socioeconomic things. And here basically is what we found. So we regressed the outcome on what the pipe was made of, what the pH of the water was, and then the interaction, which is really key, and then squared terms. And we really only find a relationship with psychological stress. And here is the relationship. The pink is lead pipes, and as we would have expected from that stylized graph, you're okay if the water is balanced, but if the water is acidic, you're at a higher risk for psychological stress later on. And not so if your pipes are not made of lead. So we don't find the effects that we would have expected on cognitive outcomes, even in high school. But we do find effects on psychological stress, and we can talk about why that would be. But so I gave a version of this talk early November, and right after me on the panel was Pam Hurd, who was also presenting work from the linked 1940 WLS data. She was talking about differences between rural and urban people. In 1940, did they live in an urban area or a rural area, and how did their lives turn out? And she found big negative effects of coming from a rural area. And she speculated that it had to do with lead. And so I immediately, what do you mean lead? They're living in rural areas. I'm studying lead in urban areas. And she said there's two factors. And so now we're collaborating on future iterations of this work. There are two things that you have to consider. The first is apples, and the second is lead mining. And so I did some background on what she meant. So coddling moths are the little creatures that whose larvae bore holes in your apples, and then your apple looks like crap and nobody wants to buy it, and that's bad for farmers. And the way in the early 20th century that you got rid of them was through lead arsenate. It's right there in the name, lead and arsenic. That's essentially what it was. And the way they applied it to the trees was like this guy. You get a hose and you spray it. This was true for 60, 70 years. That's how you got rid of coddling moths, with lead arsenic. And that was true in 1940. And so there are apple orchards in Wisconsin. And we've dug around with the assistance of Carol Roon and Joe Savard in WLS, and we've come up with county-level measures of the number of fruit-bearing apple trees in each county in Wisconsin in 1940. And of course, we know the total area of each county. And so the redder the county, the more apples there are per square mile. So if you're in Door County, you're screwed. There's apples everywhere, right? But also in other parts of the state. And so future iterations of this work will have to incorporate not just urban exposure to lead pipes, but also apple production. The other factor is lead mining. In southwest Wisconsin, these counties, there was a great deal of lead mining. We can actually get much more geographically specific. This is the area of lead mining. And within that, you can get even more specific. So this is Platteville. And so you can identify almost by neighborhood in Platteville where lead mining facilities were. Various boreholes and slag piles and all the other stuff that goes with lead mining. We know where that stuff was. And so we can pretty precisely identify who would have been at risk of exposure to lead within Platteville, but also within other parts of those counties.
So Rob, the idea is that it rains and the rainfall rolls into the water supply?
Yeah, or otherwise lead is airborne somehow through various machinations. But I would also think about occupational exposures. You know, if your dad's a miner and he's coming home dust. I mean, there's a variety of ways I think that you could be exposed. It also isn't clear with the apple orchards how far, if you're buying land that used to be an apple orchard, you'll really need to get it checked out. But if you lived a mile away, we still have some work to do to figure out really what the exposure was. So that's what we're going to do next with the WLS. But we've also linked all of this 1940 census data to 4 other aging surveys that are nationally representative. And so the agenda, particularly for Mark, over the next few years, is to do similar work nationally with samples that don't have as high a linkage rate, but are nationally representative. So that's the research talk. Let me turn to meta reflections. And these are things that I think are demonstrated by this kind of strand of research, but are also things that I've observed from hanging around CDHA from afar for 20 years. The first is that disciplines are really restrictive. I have found that over the years I've become convinced that there are no interesting questions that are just sociology or just economics or just geography or public health or any other discipline. And maybe I'm preaching to the choir here in this context, but that's something that I try to remember all the time. And I find a lot of resistance to, actually, surprisingly, in the world. The second, and this one is also obvious, is that childhood is profoundly important for how the rest of your life turns out. I've shown you this. This is 1940 census data linked to the WLS. And this is income in 1940s. This is the income of the family that people were born into when they were born, and their delayed recall task scores, which is a cognitive memory measure, 72 years later. This is their digit ordering task scores, again, related to income from when they were born. This is all-cause mortality in the high school and beyond study that Eric Grodsky is going to talk about this afternoon. This is the relationship between how far you went in math and courses. Did you get through Algebra 1, essentially? And your risk of death by your mid-50s. If you didn't make it through Algebra 1, you were at substantially higher risk of not surviving to your mid-50s. This is particularly true for suicide and heart disease deaths. The third thing I learned by hanging around here and similar places was that you, particularly with respect to data and methods, have to constantly, anybody? Come on. Willy Wonka, right? So it's this amazing chocolate factory where things are happening that could never happen, but there they are happening. I have learned over the years from hanging around here and like-minded places that you constantly have to re-examine what you consider to be impossible. And here are some examples. One that I've worked on has to do with CPS data, the current population survey data. We all treat it as cross-sectional for decades. And in fact, there are multiple demography articles. I made this small enough so that you couldn't read the name of the authors, that explicitly state that the CPS is cross-sectional. But in fact, they're not. And we now have, at IPMS, you can now immediately download fully linked CPS files for every month for the last 60 years and do 16-month longitudinal analysis. But that's a mind shift, right? Things are now possible research-wise that didn't used to be. One you may not know as much about is that the decennial censuses, which we've all treated as cross-sectional, are really not. It's the same people observed over time. We just haven't linked them until now. So we're now linking them all to one another. So we'll soon have longitudinal data on everybody in America from 1850 to 1940, and presumably others will go forward from there. And they already are with administrative data. So soon we will completely reconceptualize what we think of those data. A lot of the innovations I can't take credit for. They're very often things that Steve Ruggles or Bob Hauser taught me. The one that I remember from graduate school was thinking about the GSS as a sibling sample. About once a year, somebody asks me a question that implies that they don't know that the 1994 GSS had a sibling sample, and then they're very happy to learn that. It's actually available downstairs. The fourth thing I have learned from hanging around here is that there's really no escape from this place. And some of us were talking about how it feels like we're all always here, because I only see some people in this room. And so I feel like you're always just hanging out here. In my case, it's related to the WLS, but I think it's a broader CDHA phenomenon. So I go work on the 1940 census and other historical census data, and the first thing I do is link it to the WLS. I go start a line of research on panel conditioning, which is the methodological phenomenon whereby people who are in a longitudinal study actually change. Because they're being studied, their attitudes and behaviors are actually altered by the act of being studied. So I do work on that, and one of the first things I do is test it in the WLS. We now have a proposal to compare the 1/3 sample to the 2/3 sample who've never been followed and see who lived longer. Does being in a 70-year longitudinal study shape your mortality experiences? I tried to get away with the high school and beyond study and just change cohorts. And the first thing we do is call the WLS for advice about how to do a variety of things. So that's what I've learned from afar.